Hello everyone. We are very sorry we couldn't join you guys on YouTube very frequently because of the hectic work life. No, little bit of work and relaxing life. So in this video we are gonna tell you guys different responsibilities as an intern, RMO, registrar. Let's not talk about consultants. Okay. So first let's start with the intern. Being an intern is your responsibility to come a little bit early, maybe half an hour, just to make a list for all the patients that got admitted overnight under your team. Usually 3 to 4 patients every day you have to make a list. It hardly takes 15 to 20 minutes, half an hour is more than enough. And so you start at 7:30. Don't worry, you get paid for that half an hour. So yeah, you start at 7:30 and at 8 o'clock you print that list and distribute among your rest of the team members. So you have a list, and then once your whole team is there and you are starting the rounds, so you get that fancy thing, like we call it wow, the work on wheels. So it's just a little computer with all the tires and everything on it. So you just take it everywhere to the patients, and the main responsibility is to mainly document all the things going on the round. Maybe a consultant is talking to the patient or the relative, you're supposed to document it. If your colleague is doing it, you have to do the jobs that are supposed to, like if he's saying just give him furosemide 20 milligram now, then you chart it and sign. So that's your responsibility, to just help with the rounds. And the other responsibilities are to take the samples, maybe some cannulations, maybe some procedures like Ryle's tube, Foley's catheter, if you are experienced enough with these procedures if needed. And sometimes, even being an intern, you are supposed to review some patients that have been already admitted under your team, and then you discuss with your seniors, maybe RMO, registrar, or sometimes even consultant if you have nobody else to talk to make a plan and chart something. So that's, I think, all about being an intern.
Yeah, after intern, we have a resident position, which could be JHO or SHO, commonly known as RMOs. So the difference in their responsibility is, one, to make sure that the intern is okay and to make sure that they don't need any help. All the difficult IV cannulations or the difficult venipunctures will be given to the resident. Then things like ABGs, or when nurses are not able to get IDC in or a nasogastric tube in, that's when a resident would be required. Then of course helping with the daily rounds, daily jobs. Also a resident is often called to review patients from their team. And as a resident, you'll also be doing evening and night duties when you will be asked to review lots of patients which might or might not be from your team. So in such situation, it's expected from a resident to do an initial assessment of the patient and to have an initial management plan, and for difficult cases discuss with your registrar and make a final plan and follow up on that patient. So it's a little bit more higher than that of an intern, and the responsibility in residence might vary depending upon what postgrad year you are in. So some common calls that you might get during your evening or night shifts as a resident are some easy things like diabetes, hypertension management, or sometimes it could be a bit more complex, like a patient going into sepsis or septic shock, or this patient is not responding to fluids, or it's STEMI, chest pain. So the cause could be any kind, because the nurses, when they think that the patient is not well, the first call they give is to the resident. Unless and until they can see that the patient is collapsing, then they'll call the registrar straight away. But having said that, as a resident, you have all the rights to call your registrar and discuss any case with them, and most of them are very helpful and they help.
Yep. And then comes registrar. So registrar is a connection between RMO interns and consultants basically. So if you have a experienced registrar, he'll be working as a consultant with you guys and helping you with everything and teaching you. But it's not like he's doing only, you know, consultant work. He's just like a senior to you, so he is there for everything. If you don't know how to take a sample or maybe cannula, so he'll be doing it for you and teaching you guys. And it's not like it's kind of a shared responsibility among the team members to help each other. And but the registrar is somebody who is more responsible for everything, like just to keep everything in check so that the team work is being flowed, so everything is going smooth. So that's the work. And being a registrar, you are more responsible in a team. So whenever the rounds are there, being a registrar, you discuss with the consultant with various presentations, differential diagnosis, maybe management plans. It's not like intern can't talk. If intern thinks that this thing seems like this, then they are happy to accept your opinion as well and discussions. So most of the teams work like a team. It's not like senior junior, but most of the times registrar is more involved in the patient management. Second, he'll be helping you guys with everything. Third, in most of the hospitals, registrars are supposed to admit the patient, so they are on admissions, on consults. So every patient that's being admitted under medicine department is reviewed by registrar, and then in the morning handover, the registrar who admitted the patient overnight will be handing over to the different teams they admitted the patient under in like maybe 1 to 2 minutes over every patient. So maybe half an hour of handover for all the patients. And then on the teams, I already told you. And being a registrar, you have some more responsibilities, like if the patient is too sick and you're referring to a higher center, so you are the one who is responsible to talk to a senior consultant, maybe your colleague registrar there. Sometimes even RMOs do it. Some of the RMOs are very good with all these, you know, communication part, giving S bars. So it's not about this person is supposed to do this work. It's about everybody can do everything. It's just a matter of fact that we have divided as a team. So what happens at So what happens at 4 o'clock when you're finishing the work? If your intern is still taking the samples and cannulations, he's busy, but as a registrar, you're free. So before going home, you ask him and you try to help him so that he can get freed early. So it's not like this is a sample, I won't take it. No, you are supposed to help him. You are a team. So that happens in almost all the hospitals across Australia. That's why it's a very good country, beautiful country to work as a doctor. And we are just giving the example of intern, RMO and registrar. Even the consultants are available 24/7 for your help. So if being a registrar, if you have any doubt, any query, any diagnostic issue, any management issue, you have one consultant to call anytime. So yeah, that's all, I guess.
Yeah, so now we've covered like the basic expectations of an intern, a resident and a registrar. But we have to keep in mind that you always have this opportunity to grow if you want to. So I've come across a lot of interns who have gone up to the consultant and said, "Hello, Dr. So-and-so, I'm really interested in this department and I want to take a step further and I want to learn, let's say, how to do a lumbar puncture." And they use that opportunity, they learn it, they practice it. So it really depends. If you want to do it, you approach the right person and you learn. Nobody will stop you just because you're an intern, or nobody will stop you from doing a difficult procedure because you're not a registrar and you're a resident. So you can do everything you want to do under supervision with the right guidance, but these were just the minimum expectations that are required, and these might help you when you're considering what kind of job should I opt for. You might have a lot of experience back home, but when you think about getting a job here, you might want to be a bit safe because it's a first job in a new country. So even if you take a job which is not matching the level at what you were in your home country, it's okay. Take a couple of months, work at that level, but continue doing the things like the procedures you were doing in your home country with supervision. And I think you would be okay in the next few months.
Yes. And one more thing for you guys, as you have been asking a lot of questions, how to come here and needed guidance. So we have made a platform on TopMate. We'll be posting a link in our description. So if you have any doubts about coming here, help, you need any help with your CV, you are going for an interview. So we have divided some jobs. She's really good with the interviews and CVs, and so she'll be hosting those sessions. I'll be hosting one-to-one sessions with general queries like coming to Australia, work, life, etc. So if you are really interested in any of those stuff, just click on the link and book a session with us. That's all.
Yeah, just to add on, besides Australia, because I've worked in the UK for 1 year, so we've also got a slot on our page for queries related to UK or people who want to come from UK to Australia. So feel free to have a look at that too.
Yeah, very useful. I've been using that facility for a long time before coming here. She helped me with moving and interviews and everything. So grab your chance and see you in the YouTube, on the Top Mate, and all the best, guys.
Good luck.